those of you that have logged in, good morning and welcome. Thank you for participating in the second of our Leader Talk series, Leading Your Employees Through the Battle with COVID-19. My name is Keith Seib. I'm Director for Business and Industry Services here at Catawba Valley Community College. Working in collaboration with K64 and the Chamber of Catawba County, our goal over the next several weeks is to provide business leaders throughout our community useful information for both you and your employees as you face the challenges brought on by the coronavirus. For our second Leader Talk, Extending Lifelines to Our Employees, Dr. Keith Mackey, Executive Vice President here at CVCC, will introduce our 4 distinguished speakers today. Following Dr. Mackey, each of our guest speakers will share the emergency services available to your employees through their organizations. Then Jennifer Jones, Business Liaison with K64, will open the floor up for Q&A. Please use the Q&A function in the WebEx to submit any questions that you might have for our guest speakers. Then Cindy Fulbright, Program Manager for CVCC's Furniture Academy, will close out today's talk and give you some useful information about our next Leader Talk on April the 28th. With that, Dr. Mackey, thank you for being here this morning.
Good morning. On behalf of our President, Dr. Henshaw, and our faculty and staff, I welcome you to our Leader Talk series. And also would like to take a moment just to express our appreciation for everything that you're doing to keep our community healthy and productive. During our Leader Talk today, Extending Lifelines to Your Employees, our speakers will highlight many of the local support services available to you and your employees. We are very fortunate to have 4 outstanding community leaders with us: Wendy Johnson, Dr. Kathy Wood, Reverend Robert Silver, and Jenny Connor. We are appreciative of their time today and for their commitment every day to make our community a better place for everyone. Our first speaker is Wendy Johnson. Wendy is the Workforce Development Board Director at the Western Piedmont Council of Governments. She has served as a director for the past 10 years. Prior to joining the Western Piedmont Council of Governments, Wendy worked in the private sector in training and development. She is a graduate with an associate's degree from CVCC, yay, a Bachelor of Science from Gardner-Webb, and a Master's from Clemson University. Wendy will discuss how local workforce development area has created a virtual rapid response packet to support businesses and employees. In the past, rapid response meetings were held in person with business representatives and employees. With the spread of COVID-19 and the recent executive orders, rapid response services have taken a different approach. So Wendy, thank you for being with us today. We appreciate your work and your time that you're taking out today to be with us. So with that, the virtual floor is yours.
Thank you, Dr. Mackey. Thank you, everybody involved. Appreciate the opportunity to share what's going on. As Dr. Mackey mentioned, to give a little history of what we mean by a rapid response or a rapid response packet. In the past, prior to COVID-19, when a company would have a layoff, we would actually go out in person. Our staff from the NC Works Career Centers, from the Department of Social Services, partners with vocational rehabilitation, and our community college partners, and other assistance programs that may be applicable to our 4 counties across the region, and actually share what those services were. In times of layoffs, sometimes employees need help with child care or food stamps, if there are disabilities going on, extra support on that end. And so that was always a big partnership. And as we're finding out with COVID-19, it's always a little bit better when you can be face-to-face in person and ask questions. So looking at the workaround, what we were able to do is basically take all those services and our contacts and partnerships and compile them into what we've called a virtual rapid response packet. And all of that information can be found at westernpiedmontworks.org, or you're welcome to email me at wendy.johnson at wpcog.org, and I can send you a virtual packet. What's enclosed in this packet is actually the details on applying for your unemployment benefits, because several years ago, the unemployment component was put fully into the Department of Employment Security. And so they've been handling that. I'll come back to that in a second. There's also a pretty comprehensive list of frequently asked questions and answers for both employers and employees. We recently updated that packet. And then again, there's the direct contact for agencies such as social services, vocational rehabilitation, and the community colleges. One of the things I'll say is that in the past week, the Department of Employment Security has worked to add close to 400 new people to help offset the bottleneck that we know people have been experiencing trying to get through the unemployment issue and even the telephone. They've also added 200 private call center agents to try to help with that as well. Our staff in the NC Works Career Centers are still providing support and assistance, particularly in the way of virtual job fairs. We have that capability set up now in ncworks.gov. We also have our scholarship program, and so our career advisors are actually doing similar to what we're doing here today and setting up Zoom meetings with those participants. We're working with the U.S. Department of Labor right now to figure out how we can start to do new enrollments for the summer, because we know our community college partners are starting to enroll and get the new semesters going as we all try to work in this new, as everybody says, the new norm of how we work virtually and online through education and all types of services that you're going to hear more about today. So Keith, that wraps up the details of the virtual rapid response packet. There's other ongoing information about business loans and support that people might need, again, at our website, westernpiedmontworks.org. And we're on all the social media outlets for Facebook, Twitter, and Instagram, because we know as people are at home, that's a lot of the way they're receiving information as well. So thank you.
Thank you, Wendy. The new norm is requiring a great deal of creativity and hard work. We appreciate everything you're doing. Our next speaker is Dr. Kathy Wood. Dr. Wood is Executive Director of the Greater Hickory Cooperative Ministry. She's been part of the Hickory community for 30 years. Dr. Wood joined the Greater Hickory Cooperative Christian Ministry 2 years ago with many years of leadership in healthcare management, business, and higher education. In addition to holding a PhD in business, IT, and healthcare administration, she completed seminary studies and is in the ordination process with the United Church of Christ. Journeying with others and volunteerism are part of her core beliefs, as is demonstrated through her work as a member of various boards, PRN chaplain, and as a pastor. Dr. Wood, thank you for bringing your expertise to our Leader Talk series today, and welcome.
Thank you so much. Jennifer, can you get to the slide?
Sure. Are you able to
So
see it?
some of the things that we are offering and we have offered throughout the time that we have been in the community, which is 51 years now, is we do financial assistance. We have supplemental food that's available not only for households, but we also have pet food, and we have baby food donations that have been coming in a lot recently, which is a great thing because we've had a lot of calls about that. So when people first come to our ministry, they used to come in through our front lobby, but because of COVID, we have weekly changed some of our operations, and so we have our main lobby doors closed, but we have signage on our website, we have signage outside for them to call a phone number. And so the first point of contact is with the neighbor engagement team. Here they will listen to the concerns or the questions or the needs of the neighbors that are calling, and we will either handle that need internally with our ministry, or we will do a referral to an outside source when needed. We have a shower ministry that will be back up and running by next week. We also offer toiletries for people who may need those, either if they're homeless or if they just right now cannot afford it. We have been inundated with phone calls for people who have been furloughed or laid off, but they have not yet received unemployment. And so I'm glad to hear that Wendy's staff has staffed up to handle some of these calls. Can only imagine how many calls they're getting. But they have asked us for things like copays. They are still insured, which usually under our clinic guidelines, we handle the neighbors who are uninsured. But because of COVID and because it's an emergency crisis situation, we are listening to the neighbors, working with them on a case-by-case basis to see whether we can cover copays for them. We have a lot of people in the community who have been very generous with their donations to help us include things like that. Because we do have a full-blown pharmacy, and there are restricted drugs in there that we cannot use because they're government-based. But for those prescriptions that we can fill, we will do that. So we are working on a way, and I've got it on the slide that says April 27th. So because we had to work through a few little logistics on that in order to give people a COVID healthcare card and also a COVID food card for those who are not the ones that usually come in and the ones that usually qualify. We are waiving the qualifications for this, and then we are working with them on a case-by-case basis. Some of the other things that we are doing is we are providing a ministry inspiration where we have prayers and messages of hope, self-care tips. I have been working with a lot of the local ministers, finding out where they have food banks, where they have some hope messages, and we are linking with them to make sure that people have access to that. We also have thrift store vouchers, even though our retail operations are currently closed for people to come in from the public. We are still online for eBay and Etsy, but we also are still giving emergency vouchers. So if people need clothing, whether that be our homeless neighbors or anyone else who is caught up in the COVID crisis and may need that, we are encouraging them to still contact our ministry to see if we can help them with that. We also are providing housing resource consultations. We have a lot of great relationships with landlords, the private ones, and so we are trying to make sure that no one ends up homeless because of this crisis. Although we do not have housing ourselves, we do have staff available that can help people find housing and refer them to the places that they need to go. We also still have a SOAR representative, which can help people get disability quicker than they normally would. So there are people that are, as a result of COVID, have disabilities that they are now considering filing for that they may not have before. In our Whole Life Center, which is a recent addition, we had it pretty full and operational, but we have now working with peer support groups, consumer credit counseling, and Operation Hope that are going to be doing some Zoom meetings. So we are going to continue those operations just in a little bit different fashion, like all of us are getting more accustomed to. The Operation Hope is a free credit and money management workshop, and on May 2nd, they will be doing a free webinar for people to help. Rita Purvis is at Operation Hope is the contact for that, or you can also contact our ministry and we can connect you as well. We also are adding a laundry ministry. We had one at one time, but it was not a commercial type washer and dryer. That will be in our Whole Life Center. We have had many requests for people to be able to wash clothes. And so that hopefully will be up operationally again in a couple of weeks. And then we also have nutrition classes with the Teaching Kitchen. We have been gifted a Charlie cart, which is a portable kitchen, and it has been very successful for K through 5th grade. And we have someone willing to who was a chef and actually is willing to do some nutritional classes. for training purposes, because we're trying to make sure that those with diabetes or other kind of health issues, and they get some government food or they get some of the TFAP or the other kinds of foods, what to do with them, because sometimes they don't know what to do with these foods. So we're wanting to make sure that they know how to cook this food according to their restricted diets. Again, what I recommend people do it or encourage is, no matter what your concern or crisis may be, to call us and let us help you, either by helping you internally within our own ministry or by making a referral to our community partners. Thank you.
Thank you, Dr. Wood, for your efforts, the ministry's work. There's so many families are in desperate need going through this COVID spread. We appreciate all you're doing. Our next speaker is Reverend Robert Silver. Reverend Silver is the Executive Director of Eastern Catawba Cooperative Christian Ministry. Reverend Silver is an ordained United Methodist pastor and a member of the Western North Carolina Conference of the United Methodist Church. He has served congregations in Iredell, Catawba, and Cabarrus counties. Reverend Silver is a graduate of Lenoir-Rhyne College with a Bachelor of Science in Psychology and a graduate of the Hood Theological Seminary with a Master of Divinity. Under Reverend Silver's leadership, Eastern Catawba Cooperative Christian Ministry has expanded its operations and moved deeper into the technological age. Doing so has saved the agency considerable operational resources. Financial crisis services have expanded to fully help families in need, maintaining the agency's commitment to never turning away any qualifying family. Reverend Silver has served on several local committees in our community and is committed to working for the welfare of our county residents. Reverend Silver and his wife, Karen, have lived in Conover for 30 years. And with that, Reverend Silver, thank you very much for being here.
Thank you, Keith, and thank you to your whole team at what CVCC is doing to put this series together, and to my fellow community partners. The partnership that we have is essential to serving the community in need at such a time as this. Jennifer, I know you've got a slide up there for me. If you'd show that on the screen whenever it's convenient for you. As soon as I realized what was occurring as this virus started growing and coming into the country, and we saw the early indicators, and started reaching out to our community to see what can we do, how can we collaborate, what can we do together. Happily, last year, ETRICM became the system administrator of a client database that's really helping to network together the major, and we're inviting minor agencies into this as well. And I say minor, I'm talking about, anybody throughout our network who wants to participate. Unfortunately, we had a meeting set up to expand our database, networking into the community, and the virus kind of preempted all of that as we all kind of shut down operations. But know that that's happening. What I started to do as soon as we saw what was escalating was reaching into our business community. I've been through this before. For those of us who remember the 2008 recession, we saw what happened when employees started losing paychecks, when they started losing jobs. And so trying to get on the front end of that, I've been reaching out into the business community. So I'm grateful for those who are attending today and listening. What we're trying to do is stabilize our economy, our community, our workers, the businesses that employ so many people. To that end, ETRICM has made some special allowances for COVID-related needs. We have taken away a lot of the normal parameters that we use under crisis assistance for our more stereotypical low-income poverty population, recognizing, just like with the government shutdown with the federal workers a year or two ago, we opened up food programs for that crowd. We're doing the same thing today. And so on the first part of the help piece on this slide, call or not email, but call or visit our website. You'll find email links on the website. We're here to help you. We're here to help the businesses. We're here to help the employees. We're here to help this community. And we're recognizing that each person is going to have a unique and individual need. And so our case managers are working in that capacity already. It's not a template that we run everybody through. If one of your employees becomes furloughed or is reduced hours, or perhaps we have companies who had to release employees, our restaurant workers that are unemployed, that are coming to us, we look at their situation, what's happening in their life, and we're responding to that particular need. As a Christian agency, one of the things that my case managers do is a bedrock of our agency, the foundation, is prayer. And so as they feel the Holy Spirit moving within that case management meeting, they'll ask a client, a resident, somebody who's coming to us in need, can I pray with you? And if that person says yes, then absolutely, but it's not a requirement. It's just the desire. It's a way that we tie our faith to the services that we're giving. One of the first needs that we saw so desperate in our community was that of hunger relief. As soon as people started losing paychecks, they lost the ability to go to the grocery store. I myself, and one in particular with my age and my wife's age, and there's some underlying conditions, we are sheltering in place and we're not going anywhere. It's a scary thought for my wife to go into a grocery store. And then when you find the shelves empty. A main emphasis that we're putting on this at ETRICM is we're keeping our food pantry full. We're bringing in extra capacity of commodities. We're working with local vendors who actually through United Way that we got involved with, and we're sourcing commodities through that avenue. Our commitment to this community is to keep our food pantry fully stocked. We changed our procedures. If you know of somebody who's going through some hunger issues or food insecurity issues, they can call our phone number. You see it on your screen. We have set up a food application streamlined service to where they can call in, do everything over the telephone, and then drive to our food pantry and pick up their commodities. We have a way with our food pantry where you stay in your car, you drive through the food pickup line. We do the social distancing. You don't have to get out and be contaminated with anybody. And we're going to bring your food out to you and let you load it up in your automobile and drive away. What's important to note about the food programs, if you call and you have need, we're going to put you on a 6-month program at a minimum. In 6 months, if your situation hasn't improved, we're going to extend that to another 6-month period for a full year of food assistance. And what we're doing with that, if you've got 5 people or 6 people or 7 people in your household, we're giving you adequate quantities of food for those many people, the total number of people in your household. And so you're picking up the basic staple goods, the foundational foods that you need to prepare. You're getting the meats, the vegetables, the produce, the breads, the dairy, all of that. And then you're allowed to come back 2 more times in the month and pick up fresh produces and those perishable items that don't keep. So we're giving you a good amount of food. The other issue, and I hear a lot of this for a long, long while, is with our students in schools and school lunches. Our Student Hunger Prevention Program is serving all of Newton, Conover City Schools and all Catawba County Schools, grades K through 12, on a 12-month program. So basically, it's working off that same hunger programs that we have. We're giving enough commodities to fill the entire household with food, and we're being more sensitive with students. This is something our Student Hunger Program has done all along, is we're trying to get kid-friendly snacks. You know, a kid, when they come home from school, their job is to be hungry. Well, we want to give them nutritious foods, not junk foods. And so that's always been an emphasis. And even with the program throughout the year, let's get nutritional foods in front of these kids as their brains are developing so they can actually learn and do well in their studies. So that's ongoing as well. That's there for our community as we speak. The other paramount issue, when you're a displaced worker, whether you're furloughed, whether you're laid off, your hours are reduced, whether you lost your job totally, is what are you going to do about your bills? To that end, we're working to ensure that the bills, the foundations in your households stay stable. As we saw the pandemic growing and we realized that a shutdown was inevitable, before Governor Cooper made the announcement, I was on the phone with Duke Energy. What are we going to do about this with the city of Newton and the city of Conover with utilities? If ETRICM was told you can't open your doors, how do I know that these bills will be paid or the utilities will not be cut off? And as you well know, the utility companies and the cities that provide utilities are not disconnecting services. Banks are not foreclosing on mortgages, and the lion's share of landlords are not evicting tenants. However, you can't go through life without paying your bills. For the energy funds, those moratoriums will become due, the back rents will become due, the back mortgage payments will become due. So we're working on that, and we're maintaining that 51-year tradition we have of never turning somebody away. So as we work hand in hand with funders in our community, we're able to then take and help with that rent or mortgage assistance, or to pay the power bills, or to keep the sewer and the water on, knowing that these bills are going to come due. The other thing that I'm working on is those exceptional bills. The car insurance, the loans that you've got a payment that's due. We don't know loan by loan which lenders might go with the wrecker and pick up the car for lack of a car payment. So we're going to make sure that the people who do need to go, those loans, the life necessary medications that need to be purchased, the things that we normally do anyway, we're allowing those exceptional needs for the COVID cases, so that if there's a fear factor or of like, and this is a real factor, I've experienced this for a number of years, of those persons who don't want to come to a nonprofit agency and ask for help out of embarrassment or fear or concern. We look at you through the eyes of Christ, saying, as you are, there we are. You're having a crisis, we're not. So we really invite you to tell your employees or your associates or your friends or your neighbors who are having these difficulties, go down and apply. Let ETRICM help you. Let us put a foundation underneath of you. We don't want you becoming homeless. We don't want you living with no power on in your house. We don't want you there with no food in your pantry. I can promise you this, the grocery store shelves may be empty from time to time. Our shelves are not, and that's my goal, my commitment to this community, is that we will keep food and commodities in, that we'll have the resources to pay the bills. Already I'm working with NC Works and the Chamber of Commerce, keeping our job sheets up to date. I hope that our employers are able to maintain all their employees. But again, after the recession, when we saw so many people lose their jobs, I know what to expect. And so already we're working on that, so that when the folks come in to see us, whatever their need is, we'll be able to fully help them get back into employment, help them actually with CVCC and the Manufacturing Academy as we partner. Let us get you some more training and get you a better job. We're going to keep doing the things that we've done while we make all these allowances for COVID-19 related cases and fully help our community. So as an umbrella, as a rough sketch, that's what we're trying to do in this, and I really invite the community and the employers to reach out to us, give us a call, visit our website, email me directly. We want to help you, and so the only thing standing between us and that help is the folks that need the help coming down to see us. So with that, Keith, I'll give it back to you.
Thank you, Reverend Silver, for your ministry's efforts and for continuing to help our citizens with essential, critical needs, and also for your work in building strong support partnerships in our community. Very valuable, and we appreciate it. Thanks for being with us today. Our next speaker is Jenny Connor. Jenny is this is her 20th year as Executive Director for the Catawba County United Way. Ms. Connor attended Mitchell Community College and East Carolina University. She currently serves on several local committees serving and supporting our community. Jenny has been recognized as a Paul Harris Fellow and earned other recognitions for her tireless work helping communities in Catawba County. She received the 2009 Greater Hickory Classic Champions Award for Volunteer of the Year, 2014 Dr. Martin Luther King Jr. Dreamkeeper Award by the Maine Community Development Corporation. And in 2013, she and her husband Chuck were recognized as Lions Club Community Leaders of the Year. Jenny, thank you for being with us today.
Okay, can you hear me?
Yes.
Okay, thank you. Thank you for the opportunity to speak with our business community, especially to you, Dr. Mackey, and to Jennifer Jones and CVCC K 6014. What you just heard from the speakers, three speakers, is that we have wonderful resources in our communities. And what I'd like to do is to share with you how to find their resources as well as many more. We have a great opportunity for your employees, for your staff to go to NC 211. And if you would put that slide up for me, Jennifer. I don't know, a lot of you who are on the call today probably know about 211 because we've been talking about it with your employers for years as we go out and speak for United Way. And this service is available not only to Catawba County, but all 100 counties in North Carolina and in many other states as well. 211 is a resource so that you can either, one of two ways, you can call the 3-digit number, 211, 24/7, and you're going to be connected to an operator. That operator will either be in Raleigh, North Carolina, or in Asheville. We have, these operators will then have access to the information in there from the resources in the communities in North Carolina. In Catawba County, we have 96 resources available. And of course, we're going to connect you to those resources, and they will be able to tell you what they have available at the time. We know that resources are only as good as what each one of these organizations have available. And they have been updating their information during this whole COVID epidemic. They have been updating their information so that if they have had to change their operations, their hours of service, or have limited resources, or have increased resources, that this information is made available to the call center operators. Now, you can see that you can also connect, because many of you on the call today are probably in charge of many employees, and you may be HR. Thank you for scrolling up. Let me also just add before I go into the internet connection that the Hope 4NC is a new helpline that I wanted to draw attention to. Many of us are facing issues or have family members, neighbors facing mental health issues. It's just an unusual time. So I want to make that number available there as well. If you can't remember that or connect to that, you can also, when you call 211, they will give you that information. You can also at any time find any of our information as you see at ccunitedway.com. Visit our website, visit our Facebook to find additional information. What I'd like to share with you now is if you have access, because whenever in a normal time of disaster, the 211 call center has backup from other states around the country, and we know that now these states are in crisis as well. You could stay there, you're good, Jennifer. We know those communities are at the same time in a crisis. It's not the same as a normal disaster when we may have a hurricane here and say the call centers in Connecticut help take our calls and manage some of our calls, or in Michigan, we have wonderful relationships. So now we have had to, because everyone is in crisis at the same time, we have had to add additional staff at our call centers for 211 in Raleigh and Asheville. So be patient if you're calling the 3-digit phone number, but also we'd like to show you how to access this information online. you can go to that nc211.org, and you will come to a page that you're looking at the moment on the screen. And as you see this, you may think, well, we're in Catawba County. Well, when you go to that, you are going to put in what needs you have, and I can see here on this slide it says food, and it's also saying fill in that, and it's been filled in as Hickory. It is also pulling up, and what you're going to see is it's going to pull up, and you'll be able to scroll down. This is just a snapshot, so we're not going to. This is not live. We're not going to be able to scroll down and see all the services, but you'll be able to see the different agencies as you scroll through that represent the resources, or have resources represent food, is which that you're searching for. Now you're going to see here that it brought up East Burke Christian Ministries, and John Bailey, who helped me with this slide, made a point of saying that we want people to know that there are organizations in other communities that do have resources for families in our county. And also, we realize that all of your employers, or the employers, but all of your employees are from various communities around us. So you can also change that to look for assistance in Burke, the surrounding counties from Burke County, Caldwell, Iredell, any of the 100 counties actually in North Carolina, and find those resources. What he does, let me scroll down here. Okay, we encourage you, as you're looking for this information, you can also highlight the organization that we have, that you'll find, and you can go to their website to see what's available. I will say it's not on this slide, but on some of the information, as I've looked through in the past weeks, they have in red highlighted the resources that have been changed due to COVID. So you'll find that as you're looking for resources as well. Be sure and have information so that you can write down, contact these resources, call them before, or at least before you go or make contact, because some of them have changed their resources. We've encouraged them to update it as they have changes, but perhaps there might be some that have not changed there, so we encourage you to do that. We move to the next slide. Okay, let me scroll up. Okay, this is the other slide. This is showing you basically what you will see. I think those were in reverse, but that's okay. This is showing you when you scroll back up, when you go to nc211.org, that's the slide that you're going to pull up immediately, and you'll see the red help button, and you will be pushing that button to go to the slide that we just saw previously. I know that the nonprofits have always been working in our communities, not just Catawba County, the surrounding communities and the communities all across North Carolina. They have been there to help people who are in crisis or in need. So they are doing their work that they've been doing for years for our communities. They have had to make adjustments. They have additional information on the 211, so we hope that you will go there and look for those resources. I want to first give a thank you to also to the companies that and employees that make this service available. We have 211 in our counties because the employees have given to United Way, and these resources are made available because of the company's employees. So you're using a product that you are instrumental in making available to our communities. I want to say thank you. Please reach out. Please look for resources. Just as you heard from our past presenters, there are many people out there trying to help you find assistance. And so we encourage you to go look for that for your employees, your staff, your families, your neighbors. Thank you for the opportunity to talk with you today.
Thank you, Jenny, and thank you, Reverend Silver and Dr. Wood and Wendy. We appreciate you all being with us today. what an honor it is to have you on here sharing such valuable information that provides such great resources for those in need in our community. And you guys work very hard every day meeting the needs of our community, and we want to make sure to thank you for that today. We do have a few questions that have come in. The first one is for Dr. Wood and Reverend Silver. It's, I have several employees that live outside of Catawba County. Are they able to use the services of the Christian ministries? And if not, where should they go?
So with healthcare, we serve also Alexander County, but we usually, like Bob said earlier, we will take it on a case-by-case basis. And if we cannot serve them because of restrictions that we may have, we will refer them somewhere. But most of the time in an emergency situation like this, it's an entirely different situation, and we will look at them from working in Catawba County.
Yeah, Jennifer, I'd concur with what Kathy has stated, and unfortunately, the restrictions that are placed on agencies by the funders or the suppliers limit us to the county. And so for the lion's share, that's true for us. If somebody's giving us dollars, they're restricting it to Catawba County usage. So we're honoring that. However, we can make referrals to other agencies. I work a lot with Burke United Christian Ministry, referring people there, or Lincoln County has a great Christian ministry there that we refer folks to, and the same way over in our county. So we can help, and that's often in a time like this, folks who are always self-sufficient until a virus comes along and shuts us down, they don't know where to turn. We live this world. So give us a call, myself or United Way or CCM, give us a call and we can point you in the right direction if we can't help you.
Thank you so much. The next question is, I have several single parent employees with kids home from school. We are calling our employees back to work next week. Do you have recommendations on where they can look for daycare? Anybody?
Mm-hmm.
Jenny?
I would encourage them to go and put their information in, go to the county that they live, and put in child care. The resources should be made available. I know that the nonprofits and all of the organizations are trying to make that information available in each community.
Okay, thank you so much.
Jennifer, to that end too, DSS does have child care provisions that ebbs and flows, and so it could be right now that they're lower because if families aren't working, perhaps the kids are sitting at home. So DSS is always a great place to start with.
Right.
And there are also some additional resources. I know there are some that are emergency child care places. I can't think of them off the top of my head, but you can give us a call and we can refer you there.
I believe also Catawba County Partnership for Children and the Children's Resource Center might also provide help with those, with child care as well. One other question came in. We've never experienced anything like this in our lifetime. How can we help give our support to those who are really struggling to make it through this crisis?
Well, that's the $50,000 question.
Isn't it?
So one of the things, and I can speak to this, I think, fairly well. United Way is really great at funneling the help to where it's needed and to those persons who are asking for help, get them to the agencies that can help them. Our agencies are committed to being good stewards of resources. ETRACM has been very effective in this over the many, many years. Churches and different factors will donate their foods to us. We hand it out. Everybody wants to help, but too many people helping without coordinating it actually does not help. It's a good case in point. I was on a phone call the other day when Jenny Connor conferenced me into a Catawba County school official. They were out of food. They didn't even know who they were giving the food to. They're doing it for the right reason. When ETRACM became the administrator of our client database, if I'm giving food to somebody and that somebody goes to CCM and Kathy's people see that we've given them food, they're not going to duplicate that. So not to be selfish, but my suggestion would be to give it to the major agencies, that assistance, because we are working hand in hand with each other to ensure that we're not duplicating services, that we're getting it to the people who need it and not to the ones who maybe, like we've seen in our grocery stores, want to hoard. There's no hoarding going on in an agency, that we're parsing it out. If I give you food today, you can't come back tomorrow and get more food. You can't hoard it. We're going to give you what you need, but not anything more. So I think, Kathy, you might want to add to that, but that's kind of my viewpoint on this.
I completely concur with Bob, and the way it works is if you have everybody trying to give out food, then they're going to do exactly what Bob said they're going to do. They're going to go from place to place to place, and it goes back to the biblical statement of saying, take what you need and leave the rest for those others. And so because we, Bob helped organize this charity tracker, we can see who else is giving it out, and it allows us to be able to help those who need it and give them each one what they need. I mean, because if we all give to the same people, then we won't have enough for everyone else. So I completely concur that the best way is to give it to the major agencies and let them decide the best way to collaborate.
We do have, Jennifer, a COVID-19 fund, United Way in Catawba County, and we have made our first round of allocations. We have you can make donations either by going to our website or going to Facebook for Catawba County United Way. And I'm quite sure that many surrounding United Ways also have special COVID-19 funds that they're using and giving out grant funding. We're doing this not all at one time because we know that many of the needs change as this goes along. Our first round of applications came in, and they were approved and went to organizations just as both Bob and Kathy spoke about just now. They went to organizations that will be accountable and do serve the community without trying to, and with communication where they're not overlapping and being accountable for those dollars. So if someone would like to contribute, those dollars go back into the community in a grant process.
Good to know. Thank you all so much. We also had a question, Wendy. Could you repeat your email address again? There's someone asking about the rapid response information. They'd like to reach out to you and get that.
Sure, they can get it. They can download the packet directly if they want to do it faster through westernpiedmontworks.org. The full packet is housed on our website with other business resources, or they could email me at wendy.johnson@wpcog.org.
Perfect. Very good.
And I might add, Jennifer, if the companies would like posters, I know that right now they're probably not going to hand out any rack cards with the how to access 211. I can give posters for their break rooms or any, and all you have to do is contact our office, and we will be happy to get those in the mail to you. Some 211 posters. I know many of the companies already have those, but if someone's listening that do not have those, we will certainly get those for their employees immediately.
Very good. Well, we want to thank you all again for being with us today. You provided just some invaluable information for our business leaders to be able to share with their employees in need. I do also want to mention again that we are honored to have the Chamber as our partner on this event, and they also have a resource page on their website that you can access with lots of great resources. I believe you may be able to see that over in the Q&A section. Also, last week we had Brian Hissam and Dr. Gary Endenbaum with us, and Brian wanted everybody to know that he is a member of the Catawba Valley Association of Counselors and Therapists, and they also have some services that they can provide. So you can get in touch with him as well, especially for mental health related crises. So at this time, again, we want to thank you all. Do any of you guys have anything else you want to share or with everybody before we get ready to close out?
I don't think so.
I don't think so. Thank you, Jennifer.
Be safe.
Yep.
Thank you so much. And at this time, I'm going to turn it over to Cindy Fulbright and let her close us out.
Thank you, Jennifer. We hope these leader talks are proving helpful as we work through these unprecedented times. Our next leader talk is next Tuesday, April 28th at 11:30. We are continuing to provide information with NC Works and Centro Latino as our guest. We thank all our participants, and we look forward to having all of you attend again next week. Thank you so very much to all our guests.
I do want to mention one more thing before we finish up, and that is that the recording of today's webinar, as well as the resource packets that each of our guests have shared, will be emailed out to you later this week, and they will also be available on the Catawba Valley Community College website and the K64 website. Thank you again so much for joining us. Thank you to our panelists, and we hope to see each of you back next week.
Thank you. Thank you.
Thank you.